destruction. And you hear the bill. A corruption town. Fire burn. On this road of life, it is often said, don't burn the bridges that you cross. That may be true sometimes, but don't get lost, or you might just pay the cost. What if it's a bridge that leads to a place called Wicked Land, my man? Or a bridge to a place where true love disappeared, a place called the Fisherman's Square. I say, let it burn.
Yes, yes, let it burn. That's a song from Ras Harimo. Ras Harimo, and Ras Harimo is a reggae artist from Dominica, and that's one of his tunes from his latest album, I Am Rastafari. And he's talking about burning bridges that lead to nowhere, right? Sometimes you gotta burn those bridges, man, to move on in life. Yeah. Welcome to the vibe. Welcome to the live. Share it, share it. Prostate Health segment 2. If you're tuning in, keep locked in, man. Keep locked in to the bush, man. Prostate Health segment 2. Let the bridge burn, man. If the bridge leads to destruction, if the bridge leads to malice, if it leads to a life of lies and deception, let it burn. Burn the bridge. Sometimes you gotta burn those bridges, man. You gotta burn the bridge of bad health, bad habits, right? We'll get started in about a minute and a half. I love this song. I had to let it loose. Again, this is from Harimo. Harimo is from he's from Dominica. I think he's from One John, and that's one of his songs from his latest album. Love this tune, bad, man. So we'll get started. Just like to get pumped up with some great vibes. Stick around. Let it burn. Burn the bridge if it leads to destruction. If it leads to no good vibes, burn it. If the bridge leads to malice, jealousy, envy, burn the bridge, man. If the bridge leads to hatred, burn it. If it leads to bigotry and racism, burn it. Let it keep on burning. It's a bridge that leads to nowhere. Burn it to the ground, man. Yes, thanks to Harimo for this song, right? I don't own the rights to the music. This is Ras Harimo from Dominica. And welcome to the vibes, guys. Thanks for joining me. I appreciate you guys so much. And let's cover segment 2 of Prostate Health, okay? Before I get started, as always, I hope you guys are doing great. I hope everyone's in good health and your families are safe, all right? I care about you guys, and this is my way of showing love and support, because I know we go through a whole lot, all of us, right? Every one of us, we go through some kind of tribulation, trials, right? We all go through those each and every day, especially now with pandemic out there and social distancing, lockdowns, and everything else, right? That puts a burden on our minds psychologically and a lot of us physically, right? So just welcome to the show, and just want you guys to know that the information presented here is not my opinion, all right? But solely founded on in-depth medical research, findings, reports, analysis, and studies made available by highly established and recognized medical organizations, urologists, medical doctors, surgeons, experts, medical scientific study groups, and governmental agencies. None of this is my opinion. All right, no opinion here. It's all research based and it's all proven. All right, so as usual, before I get into my spiel, I am not a doctor or medical professional. I am an herbalist, a health educator, and a researcher. I do not prescribe medicine, nor do I give medical advice. My work is for educational and informational purposes. All right. So last week we discussed what is the prostate, and we learned that it is a male reproductive organ that is about the size of a walnut, found at the base of the bladder. Right. And we learned the three main parts of the prostate, which is the transition zone, which is found on the inside of the gland and is the smallest part of the prostate and accounts for about 10% of the size of the prostate. And we learn about the central zone, which surrounds the transition zone and makes up about a quarter of the prostate's total mass. And we went over the peripheral zone, which represents the main part of the prostate gland, and it's about 70% of the tissue mass. All right. So today we will talk about the PSA ranges, risk analysis, herbs for prostate health, cancer types, foods that affect the prostate, and prostate cancer. All right, and probably a little bit more. I mean, throw in a little bit more in there, but it's all going to be helpful information. If you know someone who needs information about prostate health, pass this on, share the live, okay? All right, so what is PSA and how important is it? Okay, PSA is prostate specific antigen, and PSA level in blood is measured in units called nanograms per milliliter, and that's based on the World Health Organization standards. Okay, so the PSA test is a blood test used primarily to screen for prostate cancer. All right, so the test measures the amount of prostate specific antigen in your blood. And PSA is a protein produced by both cancerous and non-cancerous tissue in the prostate. Right? Oh, you're welcome. Awesome. Good vibes. Okay, so PSA is mostly found in semen, but a small amount is also found in blood. All right? So the PSA level from a screening test is sometimes referred to as total PSA because it includes the different forms of PSA, okay, which includes percent free PSA, okay, and the PSA occurs in two major forms in the blood. One form is attached to blood proteins, while the other circulates free, so it's unattached. So the percent free PSA is the ratio of how much PSA circulates free compared to the total PSA level. All right, so the percentage of free PSA is lower in men who have prostate cancer than in men who do not. All right, in percent free PSA again, if your PSA test result is in the borderline range between 4 and 10, that's borderline between 4 and 10, the percent free PSA might be used to help decide if you should have a prostate biopsy. So a lower percent free PSA means that your chance of having prostate cancer is higher, and you should probably have a biopsy. Okay, and a biopsy is a medical procedure that involves taking a small sample of tissue so that it can be examined under a microscope. Usually that's done by a pathologist, and they examine bodies and body tissue and are responsible for lab tests and so forth. Okay, and this test is widely used, but not all doctors agree that 25% is the best cutoff point to decide on a biopsy, and the cutoff may change depending on the overall PSA level. And then we have complex PSA. Greetings, everyone. Greetings. We have complex PSA. And this test directly measures the amount of PSA that is attached to other proteins. Okay, that's the portion of the PSA that is not free. Remember, we have the ones that are attached, and we have the ones that are not attached. Okay, so this test could be done instead of checking the total and free PSA, and it could give the same amount of information, but it is not widely used. Okay, and then there are tests that combine different types of PSA. Okay, some newer tests combine the results of different types of PSA to get an overall score that reflects the chance of a man who has prostate cancer, particularly cancer that might need treatment. And these tests include the PHI, which is Prostate Health Index, which combines the results of total PSA, free PSA, and pro PSA. And then there is the 4K score test. The 4K score test, which combines the results of total PSA, free PSA, intact PSA, okay, and human kallikrein, along with some other factors. So this test might be useful in men with a slightly elevated PSA to help determine if they should have prostate biopsy. This test might also be used to help determine if a man who has already had a prostate biopsy that didn't find cancer should have another biopsy. Okay, so there is PSA velocity. The PSA velocity is not a separate test. It is a measure of how fast the PSA rises over time. Normally, PSA levels go up slowly with age, but some research has found that these levels go up faster if a man has cancer. But studies have not shown that the PSA velocity is more helpful than the PSA level itself in finding prostate cancer. So for this reason, the ACS guidelines do not recommend, and that's the American Cancer Society, the ACS guidelines, do not recommend using PSA velocity as part of screening for prostate cancer. And there is PSA density. PSA density. Okay, so PSA levels are higher in men with larger prostate glands. The larger the gland, okay, the higher the PSA levels are. PSA density, or PSA-D, is sometimes used for men with large prostate glands to try to adjust for this. Okay, so the doctor measures the volume or the size of the prostate gland with a transrectal ultrasound and divides the PSA number by the prostate volume. So a higher PSA density indicates a greater likelihood of cancer, right? So PSA density has not been shown to be as useful as the percent-free PSA test. Hi everyone. Thank you for chiming in, guys. Appreciate you all. All right, so transrectal ultrasound. What is it? Transrectal ultrasound. It is a procedure in which a probe that sends out high energy sound waves is inserted into the rectum. The sound waves are bounced off internal tissues or organs and make echoes. The echoes form a picture of body tissue called sonogram. Transrectal ultrasound is used to look for abnormalities in the rectum and nearby structures, including the prostate. Then we have age-specific PSA. Age-specific PSA. PSA levels are normally higher in older men than in younger men, even when there is no cancer. Right? So a PSA result within the borderline range might be worrisome in a 50-year-old man, but cause less concern in an 80-year-old man. Right? So for this reason, some doctors have suggested comparing PSA results with results from other men of the same age. So let's take a look at PSA levels. All right. Okay, so we have normal, and that's by the World Health Organization standards. Okay, so normal PSA levels ranges from 0 to 4 nanograms per milliliter. Slightly elevated PSA is from 4 to 10 nanograms per milliliter. Moderately elevated is from 10 to 20 nanograms per milliliter, and highly elevated is 20 plus. Okay, so when you go to your doctor and they do the blood work, they get some blood from you, and they send the blood to the lab, and they check it, they test it, and you get a call from the administrator or someone up front in the office who works in the office. Say, hey, your levels are such and such. These are your numbers. Your PSA levels is such and such. Okay, so normal is between 0 and 4 nanograms per milliliter. Okay, from 4 to 10 is slightly elevated, Moderately elevated is from 10 to 20, and highly elevated, 20 or more. Okay? So keep that in mind. So don't panic. You shouldn't panic if you get that call from your doctor's office saying, hey, your PSA is elevated. It may be slightly elevated, right? But usually they don't tell you if it's slightly, moderately, or highly. They just tell you it's elevated and there is room for concern. So you want to start taking action, right? If it's over 4 nanograms per milliliter, you want to start taking action, right? You don't want that bad boy to get any more elevated, right? So let's look at standardized PSA range by race, race and age. Okay, age in years, all right? So from 40 to 49 years for black people, black men, all right? It should be, the normal range should be 0 to 2, right? If you're 40 to 49 and you're a black man, your normal range should be 0 to 2.0. If you're Asian, 0 to 2.0. And if you were a Caucasian or a white person, it should be 0 to 2.5. Okay? Ages 50 through 59 for black people, African, black men, from 0 to 4. All right? So 0 to 4, if you're 50, if you're between 50 and 59, that's normal. For an Asian man, same age range should be 0 to 3. And for white men, 0 to 3.5. Age 60 to 69. For black men, 0 to 4.5. That's normal because as you age, your prostate swells. It will swell. I mean, it's something you can't really stop. It will swell. It doesn't mean that you're gonna get cancer, but it is gonna swell at some point. Okay, so black men between the ages of 60 and 69, normal range is 0 up to 4.5, and for Asian men, it's 0 to 4.0, and for white men, 0 to 4.5. And if you are 70 to 79 years of age, for black men, 0 to 5.5. For Asian men, it is 0 to 5.0. And for white men, 0 to 6.5 is normal for that age range. All right? So let's look at PSA level risk analysis. Let's look at some risk analysis. 15% of men with a PSA level less than 4 go on to develop prostate cancer. 31% of men with PSA levels between 4 and 10 have shown to develop prostate cancer. 50% to 65% of men with PSA scores over 10 nanograms per milliliter rather, develop prostate cancer. So an important part of the results is finding both the 1, total amount of PSA in your blood, and 2, the ratio of free versus bound PSA. The amount of PSA in your blood test may increase with other prostate conditions such as BPH or an enlarged prostate, benign prostatic hyperplasia. or within 2 days of ejaculation. Okay, the amount of PSA in your blood test may increase with other prostate conditions such as BPH, prostatitis, or within 2 days after ejaculation. So even though your results may be high, it doesn't necessarily mean that you have prostate cancer. It's just a greater risk of developing it. Okay, it doesn't mean you do have prostate cancer. So if you go to do your blood work 2 days or within 2 days of ejaculation, obviously the PSA result is going to be a little higher than normal. Okay, so you want to wait after ejaculation to go do your prostate test. All right, because you want to get the results as accurately as possible. Good evening, guys. Good evening. All right, let's look at some cancer types, right? Prostate cancer types, different cancers. Oh, the cinnamon tea is immaculate, man. It's pretty good. So almost all prostate cancers are adenocarcinomas. I'm going to say that again, adenocarcinomas. That's it. And develop from the gland cells. Okay, the cells that make the prostate fluid that is added to the semen. Other types of cancer that can start in the prostate include small cell carcinomas, neuroendocrine tumors, transitional cell carcinomas, and sarcomas. All right, so those are other types of cancers that can start in your prostate. Okay. What happens after cancer? Obviously, there's going to be surgery, right? Yeah, man. You develop prostate cancer, and it's they have to cut it out. So surgery is a common choice to try to cure prostate cancer if it is not thought to have spread outside the prostate gland. So the main type of surgery for prostate cancer is a radical prostatectomy, where the entire prostate gland plus some of the tissue around it, including the seminal vesicles, are removed. Okay? So in the more traditional approach to prostatectomy, called an open prostatectomy, the surgeon operates through a single long skin incision to remove the prostate and nearby tissues. So after the prostate is removed, while you are still under anesthesia, a catheter will be put in your penis to help drain your bladder, because you're gonna need help to release that pee and to relieve your bladder. Okay, so catheter is used, and usually that catheter stays in place for 1 to 2 weeks while you heal. You will be able to urinate on your own after the catheter is removed. All right, so as with any type of surgery, there are associated risks, and those risks depend in part on your overall health. It's important that you stay healthy, you eat healthy, you drink healthy, you exercise, okay, you keep your weight down, all right? Your overall health, your age, and the skill of your surgical team. Okay, so if you have a great surgical team and you're healthy, then there's less of a chance that it becomes very risky. Okay, but risk should never interfere with your decision to do the surgery. A swollen, cancerous prostate is not something you can just ignore. You can't ignore a cancerous prostate. Okay, you could ignore the common cold, a headache, a fever, a flu, a busted knee, a sprained ankle, but not a swollen, cancerous prostate. There is no way anyone can and should ignore a swollen or cancerous prostate. I know at least three people personally who have gone through surgery to remove their cancerous prostate, and they're doing well. They're doing well. Okay, so just because the procedure might be risky, okay, that shouldn't push you away from not doing the surgery. That could potentially save your life, because a lot of us men die from prostate cancer, and sometimes it's because we're macho. You understand me? We're trying to be macho, and I got this under control. No, you don't. You better get some help. You better do the right thing for yourself and save your life. You could live without a prostate gland. You'll be all right. There's some things you won't be able to do, but you'll be okay. Okay, so side effects. The major possible side effects of radical prostatectomy are urinary urinary incontinence, and erectile dysfunction. And we're going to examine those. Oh, wow. Sorry about that. Sorry about your uncle. And your dad's best friend died from it. Oh, boy. Could imagine. So, yeah. So it's not something you mess around with, guys. All right, man? Share the life, guys. Share it to someone you love. Share it to someone you love. Share it with someone you care about. Because even if you don't have prostate cancer, doesn't mean that you shouldn't be concerned. Okay? So stress incontinence might leak urine when you cough, laugh, sneeze, or exercise. Stress incontinence is the most common type after prostate surgery. It's usually caused by problems with the valve that keeps urine in the bladder. Oh, see? Yeah. Yeah, my brother, Omar. Can't ignore a swollen prostate. You should not. You gotta check it, man. That thing kills you really, really quick. It does not play. So men, we're looking at incontinence stress. Men with urge incontinence have a sudden need to urinate. This happens when the bladder becomes too sensitive to stretching as it fills with urine. So after surgery for prostate cancer, normal bladder control usually returns within several weeks or months. All right. Erectile dysfunction. We hear it a lot. And they made blue pills and different colored pills for us. We don't want to be taking those pills. Okay? What you want to do is take care of your prostate so you don't end up taking blue pills and different colored pills. So erectile dysfunction, this means that you cannot get an erection sufficient for sexual penetration. Erections are controlled by two tiny bundles of nerves that run on either side of the prostate. All right? Two tiny bundles of nerves, and they run on either side of the prostate. That's what they do, that's their job. And these nerves are called cavernous nerves, and are responsible for erectile function. Those two nerves, that's what they do. So, during surgery, if both nerves are removed, you will not be able to have spontaneous erections. If the nerves on only one side are removed, you might still have erections, but the chance is lower than if neither were removed. Okay, if either nerve bundle is removed, you might have normal erections. If neither one is removed, you may have normal erections at some point after surgery. So your ability to have an erection after surgery depends on your age, your ability to get an erection before the operation, and whether the nerves were cut. Okay? You see, just by this little bit of information, that's reason enough, guys, to be vigilant. You cannot ignore a swollen prostate. If you feel that you're having trouble peeing at the very first time, you got to go to the doctor. Go to the doctor. Make an appointment. Have it checked. Find out what's going on. Please do it for yourself. And when we get into the third segment, we're going to look at some statistics and data. So if your swollen prostate is not causing you any distress, because just because it's swollen doesn't mean it's cancerous. It's benign, but it's swollen nonetheless, right? And it swells with age, but it doesn't mean that it's cancerous. Okay? There are things you could do to mitigate the growth or the swelling, or further swelling. So if you decide to go with herbs, right? Because there are prescription medication that the doctor will prescribe for you. If you prefer to not take those, okay, you should consider anti-inflammatory herbs, roots, barks, leaves, branches, foods, juices. And we're going to touch on those in a second, okay? Anti-inflammatory herbs, right? That could help with your swollen prostate if it's not cancerous, right? If there is infection, you got to get antibiotics to flush the infection out. If it's infected, there's a higher chance of you getting cancer if you do not get rid of the infection. You got to clear the infection out. You got to get rid of that infection if there is infection, okay? And after you do that, if you want to do herbal, right? There are quite a few that I've learned about that could help you, okay? We have citrus peel, loaded with vitamin C and antioxidants, and it's anti-inflammatory. Okay, and it's a well-known fact that a diet high in antioxidants reduces the risk of many diseases, including heart disease and certain cancers. All right, citrus peel, very good. Okay, that's one. So what do antioxidants do? We always hear about them, right? Antioxidants, they scavenge free radicals from the body cells and prevent or reduce the damage caused by oxidation. That's their job. That's what antioxidants do. All right, they seek and find those free radicals and they eradicate them from the body cells. That's their job. They're like Taliban, man. Yeah, just look at them as bad boys who just want to clean up stuff, right? Citrus peel makes like orange, grapefruit, lemon, lime. All right, so that also they also provide a decreased risk of obesity, heart disease, diabetes, depression, cancer, and other diseases. Turmeric, one of my all-time favorites. Love me some turmeric. I've been researching turmeric for a lot of years and very helpful. As a martial artist, it's great for me. It keeps inflammation down. It's great for your joints. Loaded with antioxidants as well. And turmeric has been scientifically proven, okay, to have health benefits, such as the potential to prevent cancer. Okay, so the typical study dose of 500 to 2,000 milligrams of turmeric per day has potential benefits. Right, so turmeric, anti-inflammatory, very good. And when you mix this with the orange peel, the citrus peel, and put a little dash of ginger, oh man, you got a great blend for inflammation, any type of inflammation. Stinger nettle root, another awesome root. That's one of the best herbs for prostate cancer, or swollen prostate, right? Not cancer, but just your swollen prostate, right? Stinger nettle. It reduces inflammation. It has been proven to be one of the best roots for enlarged prostate problems. So, stinger nettle roots, the roots, not the leaves. The leaves are loaded with minerals and protein. And the young leaves of the nettle, you could use it for uh, salad. Okay, you could boil it. Okay, you have to boil it because it has those little stingers on there, stinger nettle. Okay, for the leaves, but the roots are what attacks that inflammation of the prostate. Okay, it has been proven to be one of the best roots for enlarged prostate problems. Stinger nettle root. Okay, so it contains compounds that act as natural estrogen blockers, and it is also used for diabetes, hay fever, high blood pressure, and osteoarthritis. Okay, stinger nettle is awesome. Okay, it will help with reduced urination flow, incomplete emptying of the bladder, post urination dripping, and the constant urge to urinate. Stinger nettle root, especially when combined with saw palmetto herb. Okay, however, if you plan on taking stinger nettle for your swollen prostate, have a conversation with your doctor if you have kidney problems. If you have kidney problems and you plan on using nettle roots for your enlarged prostate, you want to discuss that with your doctor. Okay, let your doctor know. Don't just drink it. Okay, because you got to protect your kidneys. Soursop leaves. Oh, another one of my favorites. Soursop leaves, man. So it's awesome. So the HSC, which is the Health and Safety Executive, and they're an independent regulator that aims to prevent work-related death, injury, and ill health. They are telling us that soursop and soursop leaves have cytotoxic effects in cancer. And cytotoxicity refers to the ability of a drug to kill cells. Okay, chemotherapy and radiation therapy are also cytotoxic therapies. Okay, soursop bush, soursop leaves. Cytotoxic drugs, sometimes called anti-neoplastics, describe a group of medicines that contain chemicals which are toxic to cells, preventing their replication or growth, and so are used to treat cancer. These herbs aren't joking, man. All right, and this is research. This is data I'm giving you guys. Okay, these aren't opinions. I'm giving you data. In addition, lab research on cancer cells and animal tissue suggests that soursop can suppress prostate cancer cells and reduce prostate size. All right. So a great snack for you guys, for us guys, if you want a great snack, yes, yes. And one of my viewers said that a lot of guys don't like to mess with their prostate because they think it's going to cut the erection. It's going to interfere with the erection. But you can't be freaking macho, man. You could live without your prostate. But you can't live with prostate cancer. I'd rather not have my prostate than to be dead because I ignored my prostate being cancerous. Do you understand me? You can live without your prostate. And that is so true. And that is one of the big reasons why a lot of men just die from prostate cancer. Because they are ill informed. They are ill informed. Okay? Don't die from prostate cancer. And Lynn Peters, hi Lynn. Lynn asks, how many leaves to a cup of hot water? Very, very good question, Lynn. I appreciate that. So, normally, okay, so if it's for your prostate, okay, you want to make it strong. You want to get about 10 to 12 leaves, okay? And some leaves are smaller than others, like this leaf is smaller than this one, right? So the sizes in the leaves differ, but you can pretty much make a great judgment call. 10 to 12 leaves, and you boil it. You want it to get really dark. You want it to get dark. You boil it for about 10 to 15 minutes. So these leaves, you will probably get about 2 cups of water and let it boil down to about half the size. About 10 to 15 minutes boil, covered. And after you turn off the stove, you let it sit for a few hours. Just leave it there, let it sit. It should get really, really, really dark. Okay, and the reason you want to boil your soursop leaves because of the density. It's very dense. All right, it's very, very dense. So to get the most of it, you want to boil it. Okay, if you're on the run, if you're in a hurry, you can just crush it, crumble it, crush it, put it in there, let it boil a few minutes. If you're in a rush, and you can use it. Or what you can do is prepare it, right? Prepare it for 3-4 days ahead of time. So when you need it, you got it. You can put it in the refrigerator. And like I discussed, like I mentioned a few weeks ago, tea does not always have to be hot. You could drink cold tea, it's fine. Okay, I don't know if that's a misconception, but tea does not always have to be hot. Okay, good. Thanks for your question, Lynn. Appreciate it. All right, you guys, us guys, pumpkin seeds. Yay. Pumpkin seeds. I've always mentioned to not throw out your pumpkin seeds. I always encourage you guys keep your pumpkin seeds. If you don't eat pumpkin, right, it's okay. You can purchase pumpkin seeds. All right, you can purchase pumpkin seeds. You can eat them raw if you prefer, or you can roast them. Okay, roast them in an oven pan. You put a little bit of olive oil, just a tad, a tiny bit of Himalayan salt, and you can toss in some rosemary or thyme or both in there, and you roast it for about 10 to 15 minutes on 375 degrees for about 10 to 15 minutes. Take it out, let it cool, and you have a delicious snack that is going to help your prostate. Pumpkin seeds, yes, they contain high antioxidant activity, which protects our cells from disease causing damage and also reduces inflammation. Okay, remember your prostate, your swollen prostate is inflammation, it's inflamed. Okay, so you want anti-inflammatory herbs if you go that route. I would go that route as long as it's non-cancerous. It was just benign, a benign prostate. Obviously, I'm going the herbal route because it's healthy for me. Okay, I'll be doing my other organs a service. Okay, so anti-inflammatory foods are great for a swollen prostate. Studies tell us that pumpkin seeds can stop the growth of breast and prostate cancer cells. So, ladies, pumpkin seeds are good for you too. Okay, they also induce apoptosis, or the death of cancer cells. They're great for high blood pressure, low risk of stroke, and death from heart disease. Apoptosis. Okay, so let's look at calcium and the prostate. According to the NCBI, and the National Center for Biology Information, or biotechnology information, high dairy calcium intake has been associated with an increased risk of advanced stage and high grade prostate cancer. Right? So, how do we get safe, necessary calcium that does not increase our risk of getting cancer? Right? Because we need calcium, but according to the NCBI, high dairy calcium intake has been associated with an increased risk of advanced stage and high grade prostate cancer. So if we're not going to eat ice cream, we're not going to drink dairy milk, we're not going to use yogurt and all those man-made dairy products, then how do we get calcium? Great question. That's a great question. Hey guys, let me just pause to say that I hope everyone's in good health and your families are safe. Okay? Everyone's in good health and your families are safe. Okay, so let's look at fruits and vegetables with high calcium value. You guys ready? Broccoli, Brussels sprouts, kale, collard greens, mustard greens, Swiss chard, spinach, okra, tomatoes, sweet potatoes, papaya, oranges, bananas, plantains, prunes, turnip greens, beet greens, bok choy, celery, green beans. At some point in your life, you have already eaten one of those mentioned. They are all loaded with highly absorbable calcium. Okay? The calcium content in those foods are absorbable. So your body doesn't work too hard to absorb the calcium from these fruits and vegetables. Okay? So the NCBI is telling us again, multiple ecological studies have shown a positive correlation between prostate mortality and per capita intake of meat, fat, and dairy products. Okay? So a recent case control study in patients less than or equal to 60 years found that high intake of total fat was associated with a statistically significant increase in prostate cancer risk. There are several biological mechanisms that are thought to be involved between saturated animal fat intake and prostate cancer risk by promoting prostate carcinogenesis through androgen and increasing basal metabolism, insulin growth factor, and tumor proliferation. Listen well. It's the NCBI again. High calorie intake of saturated animal fat has shown to increase the growth of prostate cancer cells by increasing the circulating levels of androgens. Furthermore, randomized crossover studies involving low-fat and high-fat diets showed that the level of androgen is lower postprandial, as well as in vegetarians. Prandial is relating to a meal, relating to a meal. So what are androgens? They are a group of hormones that play a role in male traits and reproductive activities. Androgens are a group of hormones that play a role and they present in both males and females. The principal androgens are testosterone hormones. Okay, so both men's and women's bodies produce androgens just in different amounts. Okay, so in fact, androgens have more than 200 actions in women, and they are present in higher amounts than estrogens. And androgens may be called male hormones, but Don't let the name fool you, okay? Let's look at red meat. Red meat. Let's look at red meat. And that's the NCBI again telling us that dietary meat intake has been associated with prostate carcinogenesis by correlating cancer incidence and mortality with per capita meat consumption. Studies showed that men consuming 5 or more servings of processed meat per week had a higher risk of prostate cancer when compared with men who consume 1 or fewer servings per week. We're still talking about foods, okay? The WCRF, or the World Cancer Research Fund, they are a leading authority on cancer prevention, research related to diet, and nutrition and physical activity. This is what they have to say. And they made some recommendations, right? And their recommendations are to limit fast foods. And this is the World Cancer Research Fund is saying that limit fast foods and other processed foods high in fat, starches, or sugars, as this helps control calorie intake and maintain a healthy weight. There is strong evidence that diets containing greater amounts of fast foods and other processed foods high in fat, starches, or sugars are consuming a Western type diet characterized by a high amount of free sugars, meat, and fat are causes of weight gain, overweight, and obesity by increasing the risk of excess energy intake relative to expenditure. Increasing the risk of excess energy intake relative to expenditure. So, greater body fatness is a cause of many cancers. There is also strong evidence that glycemic load, that is the increase in blood glucose and insulin after you eat, glycemic load, is a cause of endometrial cancer, which is a type of cancer that begins in the uterus. And ladies, we'll get to your segment, okay? We're gonna cover your reproductive organs real soon. So most of the evidence on fast foods is from studies of foods such as, you ready for this? Burgers, fried chicken, French fries, and high calorie drinks containing sugars such as cola or fat such as shakes, milkshakes, dairy, milk, milkshakes. Most foods undergo some form of processing before consumption. More highly processed foods have generally undergone industrial processing and are often higher in energy and lower in micronutrients. You get this? Some of these foods include potato products such as chips and potato crisps, products made from white flour such as bread, pasta, pizza, cakes, pastries, biscuits, cookies, and confectionery. So industrial food processing covers 3 main fields and will be done shortly. 3 main fields in industrial food processing. The preservation of foods by modern methods such as refrigeration, canning, and irradiation. B, traditional methods such as drying, salting, smoking, fermentation. 2, development of protein-rich foods. And 3, food additives. Okay, so those are the 3 main industrial food processing fields. Heavily processed foods often include unhealthy levels of added sugar, sodium, and fat. These ingredients make the food taste better, but overindulge leads to serious issues like obesity, heart disease, high blood pressure, and diabetes, lacking in nutritional value. Lacking in nutritional value. All right. So next week, we're going to discuss statistics and data, and we're going to look at some really interesting numbers in mortality by race and age group, right? And that's all we're going to talk about next week, because there is so much information. Couldn't divulge all of that in one session, right? So we'll look at some data and statistics from reputable sources. All right, next week. So you guys take care of yourselves, stay healthy, and don't forget, I'm not a doctor, I'm an herbalist. I'm a health educator and a researcher. I do not prescribe medicine, nor do I give medical advice. All my work is for information. Okay, it's just for information and to educate whoever is interested. All right, so take care of yourselves. I love you guys. I'll see you next week for segment 3. All right, everyone, have a great night and enjoy the rest of the week. All right, guidance.